Mon Health Talk, a weekly program focusing on the dedicated physicians, nurses, and staff at Mon Health, the region's premier community hospital system. People with skillful hands and bright minds using state-of-the-art technology. We don't just practice medicine, we care for people like family. That's why at Mon Health, you can feel the difference. Once again, welcome to this edition of Mon Health Talk.
And joining us in studio this morning is Tricia Julian, oncology nurse navigator at Mon Health Medical Center. Good morning, Tricia.
Good morning, David.
Thanks for stopping by today.
Thank you. Glad to be here.
You're going to have to explain to me in a moment what a nurse navigator is, and we'll get into that here in just a second. But we always like to get to know our guest a little bit. So tell us about Tricia Julian. Where are you from? How did you end up at Mon Health?
Well, I'm from Fairmont, and I've been a nurse for a very long time. And I've been an oncology nurse for over 30 years, about 35 years. And I've done a lot of different jobs within the confines of oncology. I've been a teacher. I've been a chemotherapy nurse. I've been the nurse navigator, been in charge of the Commission on Cancer surveys. So a lot of different things that are encompassed within the field of oncology.
What drew you to nursing in the first place?
My mother was a nurse. I had multiple people. My grandfather was a doctor. I had a lot of people in my family who were in the medical field, and I originally wanted to be a vet, although I don't usually tell my patients that. But I transitioned then to the nursing field just because I love the aspect of taking care of people and trying to help in the process of getting them better.
From where I sit, and when we do this show and we talk to doctors and nurses and physicians' assistants, it seems like it takes the right person to fit, different disciplines, whether it's oncology or it's surgery or it's, pediatrics. You've got to be the right person to fit that field. I would imagine working with cancer patients, being in that field of oncology, it can be quite difficult.
It can be difficult. You have to really love this field of nursing to do it long term. But I just find it so rewarding, and my patients have given so much to me over the years. I've learned to live vicariously through them and learned to live each day to its fullest and learn to live with hope. That hope can take a lot of different directions, but they have just been some of the most wonderful people I've ever come in contact with.
You kind of answered the question that I wanted to get to next. If you learn anything from your patients, because sometimes, you think you have troubles. The dog needs walks. I got to do this. My car's breaking down, whatever. And then, the right person comes along and can put all of that into perspective for you.
Yes, they certainly can. You wake up in the morning with a headache and start to feel sorry for yourself, and then you go to work and see these people who have been battling sometimes for years and doing it with grace and dignity.
What we're going to focus on today with Tricia in studio is the Wig Bank at the Mon Health Cancer Center. I'll let her explain what that is, what's available, who it's for, how you can help. We'll cover the whole 9 yards coming up this morning. Joining us in studio this morning, Tricia Julian, oncology nurse navigator. Before we go, you got to explain to me what's a nurse navigator?
Okay, a nurse navigator is someone who meets with the patient at the time of their diagnosis and walks through the journey with them of their cancer experience. We try to hit the patients who are newly diagnosed, but we may interject into a patient's experience midway or even toward the end of their cancer journey. We help them with things like financial aspects of their treatment. We help them with things getting scheduled, or appointments getting scheduled, and so on. So just anything that is encompassed within that realm of time that they're going through their treatment.
You help navigate the journey.
Absolutely.
As the title would imply.
Yes.
Tricia Julian, oncology nurse navigator, joining us in studio this morning. We'll talk about the Wig Bank when we return. You're listening to Mon Health Talk on WAJR. Tricia Julian, oncology nurse navigator at Mon Health Medical Center, joining us in studio this morning. And we want to focus in on the Wig Bank at Mon Health Cancer Center. And Tricia, what is the Wig Bank?
The Wig Bank is a place where patients can come who are experiencing cancer and get free wigs, free hats, free scarves, all of the types of things that they may need for head coverings. Many of the cancer treatments that we do results in the loss of hair. It can vary from just thinning of hair to total hair loss. And cancer treatment is very expensive, and many people really struggle to pay for their cancer treatment. So we wanted to have a place where they could come to get these things and have no added expense. So we don't care whether they're getting their treatment with us, with somebody else at another place. We really don't care. We want to provide these things for cancer patients who have hair loss due to cancer treatment.
Is that one of the first questions that comes up when you get a patient diagnosed and you're walking them through, this is what's going to happen?
It depends. That's the premier thing on some people's minds. A lot of people have nausea and vomiting, the potential for that on their minds. A lot of people have various things on their mind. Sooner or later, it usually comes up, obviously much more with women than it does with men.
So who is the Wig Bank for?
The Wig Bank is for anyone who is going through treatment or who has gone through treatment and experienced the hair loss. Hair loss typically lasts about 2 to 3 months following your completion of your treatment. So that can extend for quite a few months. And the hair can come back in a different color, a different texture than what they had prior to their treatment. Sometimes that reverts to their regular color and texture a year following treatment, but sometimes it stays what they come back in with. And so they can come to our wig bank and get fitted with a wig that's similar to their own hair. Some women choose to go a completely different color and a completely different style just to do something different. We have scarves for people who don't want to wear wigs. Sometimes people feel like wigs are too uncomfortable, they're too warm, they're too bothersome. So they choose instead to wear scarves or hats, and we have myriad scarves and hats that they can choose from as well.
How did the Wig Bank get started?
Well, I had a wig bank in Fairmont when I was working there, and when I came to Mon General, I said, do we have a wig bank here? And they said no, and I said, well, we're going to have shortly. So found an empty room, and we got started. We had some grants from the Oakland Foundation, from Mon General's foundation, who has worked very, very closely with me. We had a donation from an actual patient and her husband who were so pleased with the treatment that she got at Mon that they wanted to donate to the Wig Bank. And so we put this all together, and the American Cancer Society helped get us started with donated wigs, and then we went out and purchased some different supplies with the monies that had been donated. And so that's basically how it got started.
What's the source of funding for the Wig Bank?
Well, we just get out into the community and try to encourage people to make donations. It all stays right with us. It all goes directly to the Wig Bank. And so the foundation has been great in helping us to raise monies to make sure that that continues.
We're talking to Tricia Julian. She's the oncology nurse and oncology nurse navigator at Mon Health Medical Center. We're talking about the Wig Bank at Mon Health Cancer Center. So navigate me, if you will, through the process. When a patient walks into the Wig Bank and says, I'm here, what's the process?
The first thing we ask them is if they want to stay with the same color and style that they have. If they don't, I have wigs in multiple bins that we can look through. It's a very private room. We can close the door. They don't have to feel uncomfortable about taking hats or scarves off, or feel uncomfortable in any way about the state of their hair loss. And we just sit them down at a little dressing table. We let them try on as many wigs as they want. Sometimes the first one they try on is the one that they take. Sometimes it takes 6 or 8 times for them to find one, but we really work with them until they find something they're comfortable with.
What kind of feedback do you get from the patients?
Oh, patients are just so grateful. We've had so many patients who have said that they were just so thankful that the wig bank was there. And a secondary benefit of this wig bank, for me especially, has been the feelings that I've gotten from watching our staff go in and get to put wigs on these patients and help them really feel better. And the staff is just so wonderful about helping those patients feel better and dressing them and getting their wigs on or their scarves on or their hats on and giving their opinions about what they look like in the wig. And it's just been a wonderful experience all the way around.
You're talking to a guy who uses, zero blade on the clippers here. So but does it just help that overall sense of normalcy?
It really does. It really and truly does. And the closer that you can get somebody to their normal while they're going through treatment, the better they feel, especially with women. Men, the hair loss, there are so many bald guys now by choice, so that sometimes doesn't really impact them as much. But women, our hair defines who we are, and when you lose that, it really impacts their sense of well-being, their sense of who they are, their sense of normalcy.
Tricia, Julian, oncology nurse navigator, joining us from Mon Health Medical Center. We're talking about the wig bank at Mon Health Cancer Center. We'll continue that conversation on the other side of the break. It's Mon Health Talk on WAJR. Talking about the wig bank. If you didn't know it was there, it's there. Trust me. And Tricia, how can patients get access to the wig bank?
Patients can call my office at 285-2622 and make an appointment with me to come in, or they can come up to the infusion center on 3rd floor and ask to see me or ask one of the nurses to take them back to the wig bank.
Once you get them in there, you talked about it. It's a very private room. It's a private process, so you can find the style. You can find what fits you best, and at the end of the day, that's what you're hoping for, is to find the best fit for the patient. So ultimately, you get the best outcome at the end of the day.
Yes, that's absolutely true. And we've had several patients walk out of the wig bank with their wig on that they chose and just look so lovely and feel so good. So it's very, as I said earlier, it's a very heartwarming experience for us.
Do patients come in maybe a little skeptical at first when they walk in? Because, wigs, toupees, we make a lot of jokes about those.
Yes, at times they do. I had a lady who talked about being on the interstate in her car and having her window down and her wig blew off and over to the side of the road and she had to stop and pick it up. For the most part, patients have a sense of humor about it, but I'm sure they wouldn't want their wig falling off in the middle of dinner either. So we have ways to prevent that from happening. So we see various degrees of patients being serious, patients being silly. It just depends on the patient.
And again, patients, who is this available to? We've kind of mentioned women mostly in this show, but is it only limited to women?
No, we have some baseball caps for men. Now, we don't have hair pieces or anything for men, but we do have head coverings in the baseball caps and things like that they can come and see. And so it's for anyone, basically.
Tricia, Julian, oncology nurse navigator at Mon Health Medical Center, joining us in studio. Again, folks can give you a call. Is there an online presence at all to learn more for folks who, patients who maybe, are kind of on the fence or want to get involved? Any online presence? I'm looking here, Emily. Facebook page. I should know that by now. Daggone it. I should know that by now. Go to the Facebook page.
Yes.
Thank you, Emily, the expert over there. Thank you very much. Everything's on Facebook. You should know that by now.
That's right, yes.
For you, what's the most rewarding part about being involved with the Wig Bank and just working as a nurse overall?
Well, I've had experiences before with patients who were much younger, who were at the point where they were getting ready to quit their treatment because they didn't feel normal, they didn't feel human, they felt like they had lost their essence as a female. And to get them in there and to get them fitted and to change their perspective on themselves, I've actually had patients choose to continue treatment because of that. It's that important to some patients, and particularly with younger patients. We have a much younger patient population with Mon General. We have a lot of patients in their 30s and 40s, and it's very, very important to them, especially if they've got smaller children, if they're out in the workforce, to look as normal as possible. And so we hope that we'll be able to help with this. And I guess my favorite thing about being a nurse is the strength that I take away from my patients, the wonderful stoicism that they have, and they just are letting nothing get them down, and it's just very, very inspiring to watch.
Tricia Julian, oncology nurse navigator at Mon Health Medical Center, been talking about the Wig Bank. Tricia, thank you very much.
You're welcome, Dave.
Coming up, Fox News local news and the talk of the town straight ahead on WAJR.